The glute max has two big insertions, one that comes down and attaches to the back of the femur, and the other portion that goes around and kind of comes a little bit around and over the trochanter and down into the TFL. So essentially we have two big portions of the glute, one that's basically pure extension, one that has some abduction qualities to that as well. Now, they're also in different layers, meaning that the lower portion of the glute, the part that does the hip extension, sits deeper than the superficial portion of the glute max that does the abduction. So when we're looking at this, what I've done here is in the pink and the blue, that represents where that kind of superficial, that lateral portion of the glute that's going to come across to the outside is, but the blue represents where there's some of the lower glute that kind of sits underneath there. So this is important when we're looking at the data and the research that's available, because when we look at how these divisions are segregated and the fact that this abduction is superficial to that, that is going to impact what shows up in the research if people are placing sensors on different portions of the glute max. So if we look at this, this is just a quick table from a meta-analysis of looking at glute max function exercise, and you'll see this repeated statement of 50% the line between the sacral vertebrae and the greater trochanter. And again, you'll see a bunch more of those here. So the majority of those are basically taking this sacral vertebrae over to the trochanter. They're taking a line there and they're placing the sensor right in the middle of that. So you can see this is kind of what that would look like on our overlay there. So it's on the abduction portion of the glutes because those sit superficial, and it's going to then bias the data towards saying abduction exercises may be better, when in reality we're not seeing what would be best for those lower glutes, the ones that make up the majority of the hip extension, the majority of the volume of the glute. Okay? If we look at when the three studies by Brett Contreras referenced in here that separated the upper and lower glutes, he qualifies that as superior to the iliac spine and the posterior greater trochanter. So now we're looking something like a line like this coming through there. And then for his upper and lower glutes, he's looking at like superior and lateral and inferior and medial of the line. So by looking through the papers and whatnot, this is kind of my estimation of looking at how those sensors were placed. But as you can see, both of those sensors are still placed on the part of the glute that would be biased towards having more of an abduction quality to its motions, and nothing that's really isolating this. So when we look at what we do, we take sensors and we place them across all of these divisions so that we're actually getting accurate data across those lower glutes. And we actually look at two sensors there. So you can see the D and E here reflect sensors that we place that give us lower glute data that isn't going to have interference from those lateral superficial fibers that would have that abduction biased. This is an example here of subjects that we used. There's a little bit more anterior pelvic tilt in this picture, which makes this portion look a little bit bigger. But you can see we got those two sensors on the actual lower glutes where there's not going to be interference. And then we have basically two sensors up there because there are two divisions that we know of that lateral portion of the glute. So we're trying to not only get those two divisions, but also get that point where those muscles overlap. So when we're looking at exercises, we can see true separation between lower glute and kind of that lateral portion of the iliac glute max, and kind of also where they overlap there as well. So when it comes to looking at the data, right, you can't just say like, this is better for glutes. It has to be specific. You have to understand the data that you're actually looking at.